Good afternoon, everyone. Today, our group, Brianna,
Ariana,
Aisa,
will be presenting on vulnerable population, which is pregnant women without health insurance. This group faces significant barriers that increase their risk for poor health outcomes, including limited access to prenatal care and essential medical services. Without insurance, many delay or avoid care, which can lead to complications during pregnancy and childbirth.
according to the Centers for Disease Control and Prevention, nearly 1 in 10 women in the United States start pregnancy without health insurance. Women who lack insurance are 60% more likely to delay prenatal visits, and this delay can contribute to conditions like preterm birth and low birth weight. The U.S. maternal mortality rate is about 22 deaths per 100,000 live births, but for uninsured women, the risk is nearly twice as high.
These statistics highlight how essential access to healthcare is. When early warning signs like high blood pressure or gestational diabetes go untreated, it increases the risk for both the mother and the baby. The main vulnerability for this population stems from financial limitations that restrict access to affordable healthcare, healthy food, and stable housing.
To understand these challenges, we could look at the Gelberg and Anderson behavioral model for vulnerable population. This model helps explain the factors that influence healthcare access by dividing them into three main components: predisposing, enabling, and need factors.
Predisposing factors include low income, unemployment, limited education, and lack of social support. Enabling factors are barriers such as the absence of health insurance, limited transportation, and difficulty finding affordable healthcare providers. Need factors refer to both perceived and actual health needs, such as anxiety, depression, or untreated medical conditions.
When we apply this model to uninsured pregnant women, we see that these factors overlap with what public health calls for social determinants of health. This includes the environments where people live, work, and grow. For instance, living in an unsafe neighborhood or lacking access to nutritious food increases both physical and emotional stress during pregnancy.
Research also shows strong connections between these determinants and outcomes. Women in low-income neighborhoods are 25% more likely to experience preterm labor compared to those in higher income areas. Unemployment and unstable housing can make it difficult to maintain consistent prenatal visits or afford medications and healthy food.
As nurses, we have an important advocacy role. We can educate patients on free or low-cost community programs, connect them with Medicaid or CHIP perinatal coverage, and promote transportation services for appointments. We can also support initiatives that expand access to maternal care in undeserved areas.
Mental health is another major concern for this population. The National Institute of Mental Health reports that around 20% of women experience perinatal anxiety and depression. However, uninsured women are far less likely to receive therapy or medication, leaving many symptoms untreated. Anxiety often comes from worrying about medical bills or the baby's health, while depression can stem from isolation and financial hardship.
Untreated mental health conditions can lead to negative outcomes such as poor maternal-infant bonding, premature birth, and postpartum complications. Screening for depression and anxiety during prenatal visits should be standard practice even for women with limited access to care.
There are multiple tiers of support available. For example, self-help techniques like mindfulness, journaling, and regular exercise are free and can be encouraged by healthcare providers. Peer programs like those offered by Mental Health America of Greater Dallas and Catholic Charities provide support groups and parenting education.
For professional resources, the National Maternal Mental Health Hotline at 833-943-5746 offers 24/7 support. Texas Medicaid for pregnant women also helps cover prenatal and mental health services. These programs can significantly reduce stress and improve pregnancy outcomes.
To improve care, overall health system should focus on outreach and early intervention. Community partnerships, mobile clinics, and educational campaigns can reach uninsured women who may not know help exists. Hospitals can also collaborate with nonprofits to provide vouchers for prenatal visits or connect families with nutrition programs like WIC.
Policy-level changes are equally important. Expanding Medicaid eligibility during and after pregnancy, improving access to affordable childcare, and investing in maternal health education would create long-term improvements in outcomes. In summary, uninsured pregnant women face multiple barriers that put both them and their infants at risk. Through advocacy, education, and community collaboration, nurses and healthcare professionals can play a key role in promoting equity and improving maternal health outcomes. Thank you for listening to our presentation.
Bye!